Welcome, everyone. We'll be starting in just a moment. Welcome to today's webinar. We'll begin shortly. Welcome to our webinar. We'll be starting in just a moment. Welcome to today's webinar, everyone. My name is Heather Zemo. I'm the Education Director at IAHSS. Thank you for joining our webinar today titled Inside the Win, What Drove Our Healthcare Security Breakthroughs? The Journey to the Lindbergh Bell Award. Brett Bramlett will be presenting this. Feel free to use the chat feature to introduce yourself. There will be time, or hopefully there will be time, at the end of this presentation for your questions. Please hold off with submitting those questions until the end, and you can use the Q&A option that's on the bottom of the screen. This webinar is being recorded, and it will be available in the IAHS store shortly after, and the PDF of the slides will also be available. Now I'd like to introduce Bill Navahar, who's going to do a brief introduction before we get started. Bill?
Hi, my name is Bill Navahar. I'm president of the International Association for Healthcare Security and Safety Foundation. The foundation is responsible for research. There's three pillars to the foundation. Research, which includes publications, research such as white papers, research projects, and the crime survey. By the way, I do need some more crime surveys, so please get your crime surveys in. We also have 4 scholarship programs that will take care of anything from your CHPA to continuing education. And then we also have scholarships that we do for white papers and research papers as well. But what we're here to talk about today is the awards. The foundation awards every year a series of awards that are found at ihss.org awards, and I'll put these links in the chat here later. But I'm here to talk about one very, very important award, and that's the Lindbergh Bell Program of Excellence. This particular award is presented to the facility which has established, administered, and maintained an outstanding healthcare security and safety program for a sustained 30-month period. This is also referred to as the Lombardi Trophy for Healthcare Security and Safety. I want to talk a little bit about the application process and the selection process, just to make sure that everybody is on the same page of music. The application process is done online. You can go to the IHSS Foundation website, click it on, and submit your documentation and your nomination process. A little bit about the selection process, because everybody thinks that Bill Navahar is behind a door, throwing darts at a dartboard to see who wins the program. And that nothing could be further from the truth on that. The selection process is a committee is formed. It's a double-blind process, so nobody knows who is doing what. And it essentially is a double-blind process that goes from the selection committee. A selection committee everybody works independently of themselves. They evaluate every submission independently and they score it. Those scores are then sent to a third party. That third party then tabulates the results of the 5 evaluators, and then that information is sent back to the IHSS Foundation, and from there we make the notifications on who won and who didn't win. So it is my distinct honor and pleasure to introduce Brett Bramlett. He's a mover and a shaker, Huntsville, Alabama, the 2025 Lindbergh Bell awardee. Brett, go ahead.
All right. Thank you, Heather, and thank you, Bill. So we will get started. Again, my name is Brett. I've been in healthcare since tomorrow is my 35th anniversary with my current employer. I started out valet security officer and have a bachelor's degree in business administration, master's in healthcare administration. More importantly, I've been a member of IAHSS since 2002. Next month will be my 23rd year. I'm a CHSP and a CHPA. Learning objectives for today. Basically, in a nutshell, we're going to talk about best practices that we've kind of employed, team development, and then kind of sharing with you how we gathered the information, and you know, to show that the improvements are being made. So a little disclaimer, and when I say we, I'm talking about my team. You know, this award is not an individual award; it's a department award, and all of our leaders and our employees, boots on the ground, worked hard to accomplish what we did to be recognized. But in saying that, I'm just going to share a piece. You know, our awards packet was actually about 32 pages long, and then the supporting documentation put it over 200 pages when you know, we included stuff with that. So I'm not going to be going over everything. As Bill said, this is a foundation award, and I do not speak for or represent the foundation in any way. Also, what I'm talking about today is not intended to be a diagram or a roadmap for you and your organization if you're planning on putting in for the award. And naturally, I will talk specifically. You know, we use Moab for de-escalation. There are a lot of great companies out there, Evade, you know, Gracie Medical, and what have you. We just selected Moab. So when I name a company, I'm not promoting them. I don't get paid by them. That's just what we selected to use and what have you. So I hope that makes sense. What we do as a department. My department is responsible for the security, workplace violence, prevention, and education for the system, courier support, patient transport support, surplus warehouse, that's furniture and equipment. We're also responsible for organizational badging, parking, fleet management, fire prevention, and confidential document storage. So who we are. As a health system, we are based out of Huntsville, Alabama, and we are Alabama's fastest growing and largest city at this point. We're a 14 hospital system located in North Alabama, and we do have one hospital in South Tennessee. We currently have almost 21,000 employees in our system with just over 2,500 licensed beds. We're proud that we accomplished the Program of Distinction by IAHSS in 2016. And according to the website, that makes us the third longest consecutive program. It's achievement to get that distinction, and it's difficult to keep it up, and we're proud that we've done that. We also work with other chapters from Indiana and Texas. They helped us in 23, and we started our own state chapter. Our first in-person state chapter meeting was last December. We had over 50 in attendance. We've doubled our membership since implementation, and we're actively involved in each year getting our proclamation. And we were fortunate enough that Governor Ivey allowed us to attend her signing the year before last. So many of you know Ryan LaFleur from Motorola Vigilon, and you've probably heard him say this, that in college we call it plagiarism, but in healthcare we call it best practices. And so a lot of what I will share today, many of the ideas came from other directors, and honestly, several of them came from the IAHSS AC&E. And sitting through courses and listening to what other organizations have done. And like I said, we have 14 different facilities. Each facility has its own personality. Each facility has its own president. And so every facility is a little different. So we put our twist on things that we've learned. We typically organize all our thoughts through at least one of the 5 T's, and that's talent, teamwork, training, technology, and trailblazing. It's okay to be first. We talk about trailblazing. It would bug me years ago when you would try to present something and you were asked what other organizations were doing, And then other meetings, they were asking you to be the best. And so to be the best, you got to have a plan and just keep working towards it. So pretty much everything you'll hear today will fall between one of those fives. We're located in Huntsville. We're known as the Rocket City, but you know, a lot of the stuff we do is not rocket science. It's basically doing simple better. And this is the last kind of example I will give. You know, rope is stronger because it's made by twisting fibers together, and that distribution of fibers prevent weak points. So everything that we do, I don't think there's one answer or one thing that we can do that's more important than any other. So whether it's your training, your recruitment of people, you know, your retention rates, your de-escalation, what have you, they're all fibers that wind together to build your program. And talking about our department training, we believe that when we train people that we need to make it difficult because smooth seas are never created by skilled sailors. Our department training, 100% of all of our staff, before they ever work 1 minute, go through the hospital orientation, MOAB training, AVERT, which includes tourniquet training, CPR. They're also taught to observe and report naturally, and secondary responders for nonviolent incidences. This is training that we do for all transporters, couriers, clerical staff. And then, you know, what we're really proud of is that 21 years ago, we started our, what we call our Pride Academy. Pride is just an acronym, but 100% of our security officers since 2004 attend this academy and are IAHSS certified prior to any post assignment. And we made that decision 21 years ago, and we've stuck to it. And it's tough at times. It requires sometimes it requires salary leaders to work post on the weekend when you know, when COVID hit and what have you. But we've maintained that. The QR code there at the bottom, if you're able to scan that will show you a recruitment video we put together in 23 that shows a little bit that we share with people as we're trying to recruit them onto our team. But every officer going through the academy, again, they're CHSOs. They're certified in AVERT, which is your basically active shooter training for the most part, active violence. PATH, which is tactical handcuffing, MOAB, OCAT, which is our OC spray certification, CPR, and then TASER. We do require exposure to OC and TASER. And we get people, you know, we do that third week, and we do have people that back out at the last moment. And so that's unfortunate, but we want people to have that experience if they're going to be carrying it. So this is something that we put together. It's an advancement option for all of our team. So you'll see on the left, we have all of our different positions and then the minimum training. So couriers are required to have MOAB. They have the opportunity to be in CHSO, and if they do so, they get a raise. Visitor control, the same as courier. Officers, the minimum is CHSO. They have the opportunity to do the advanced training, and with that, we do a different uniform for our advanced folks. And then there's a raise involved. Dispatchers are the same as officers. Team leads are required to have advanced, and they do the supervisory and get a raise. All of our supervisors naturally have to do the basic, advanced, and supervisory, and they have the option for CHPA. And then manager, CHPA is required in 24 months. State of Alabama, we have 4 CHPAs, 3 of them work for our organization. So pretty proud of that. And we have 2 other leaders that are sitting for their CHPA before year's end. The result of that is we have 137 IAHSS certified employees, and you can see the breakdown there. We're pretty proud of that fact. And it's the backbone of our training. What we do to retain talent. Little funny story. These are our TNT cards, and we do an awards. I'll talk about it in a little bit, but we give awards for folks that get the most cards given to them. And I'm an Alabama fan, so Alabama does a thing that's called takes no talent, because it takes no talent to be on time and to be nice to people and doing the little things. And so we originally had our marketing team put this together, and then once we printed it out, it was not a good appearance, and we didn't think our team would receive it very well. That we were kind of saying it takes no talent to do what they do. So we kept the TNT, but we changed it to talent and teamwork. But those are the 4 things that we look at, and these are business cards. We walk around with them, and as we see our staff doing good things, or we hear. We write that down, we give them a card and acknowledge them, and then they get gift cards when they get 5, and then we give 3 TNT award during IAHSS week, and so that's the 3 that get more cards than anyone. We do 50 cups of coffee. Every salary leader sits down with at least 1 employee every week, so that's 50 employees for each leader, and so we just, and it says 50 cups of coffee, but we get their favorite drink. If they like Diet Dr. Pepper, we'll buy that. And so we'll just sit down with them and ask them, try to find, more information about what's going on with them, why they stay, what their, what's going on in their life, their family, and what have you, and just building relationships. So, we're really proud of this. We've had 4 Employee of the Months in the system, which is almost unheard of for a support department. Quentin was August of 22, and John was January of 23. Craig was this past December, and Milton was July of 24, but he is also the 2025 Employee of the Year for the entire system. So retaining talent is important, and doing what these guys do every day is being acknowledged by our system also, which is pretty impressive. So when we first came up with this idea, we in our leadership team, we had a little mixed emotions about whether this was cheesy or not. But we do officer cutouts, and you can see there's different studies that show they work. And so we'll take officers, we'll take their picture, we'll do a cutout. They're standing with a blank sign, and then we have various signs that are basically Velcroed on. So we can move the officers around to different locations, different facilities. Some signs say, please lock your car, have your ID ready. But the staff really enjoyed this. You can see that middle picture that was posted on social media. They go and they take pictures with the cutouts and what have you. But it's really important. People get off the elevator. There's an officer standing there that's reminding them to have their ID when they get to the lobby. We started doing workplace violence magnets, and I know a lot of facilities do something like this. What we opted to do is when someone displays violent behavior as a patient, the nursing staff and security always knew about it, but the support staff, food service, environmental services would not always know. So we did training, and then we put this magnet on the top right of the door frame, outside the door frame. It actually, you can see that's an NFC tag. That also becomes a checkpoint for the officers assigned to that building and our K9 team. The patient is then put on a part of the process is they're put on disposable tableware diet so that they'll have plasticware instead of metal utensils. And since it's an implementation, we placed over 200 of these, and we've had 0 assaults from repeat offenders. We're pretty proud of and remain consistent with that. Not going to bore you to death with technology. I know all of us have technology. Technology is growing. That just shows that we as a system have made advancements. We've spent over, or we've invested over $5 million in advancing technology in the past 30 months or over 30 months now. And you can see even from the numbers that we submitted, that little chart to the left shows that we had 1,588 cameras when we submitted in January, and now we're over 1,850. So we're continuing to add cameras in strategic locations. So years ago, we had covert under the desk buttons, and you can see we still have 230 of those. But one of the things that we noticed is when someone's in your face, that works fine. If someone were to pull a weapon or a gun and to quietly, do the covert under the desk thing, but when someone's being loud and chasing you, it's kind of hard to run behind the desk and find that button hidden under it. So we do the more of overt code gray buttons. They're strategically placed at the nurses' stations. So, you're fleeing from someone being violent and you just hit the button as you run. We have over 100 emergency call stations in our parking lots. And we're pretty proud of the next one. We started doing the personal wearable duress devices. We currently have over 3,200 clinicians that are wearing those, and when that button is pushed, we can track them on a floor plan within 15 feet of where they press the button, and it follows them. So if they're fleeing, we know which way the employee's going, and we're able to respond accordingly. We've been doing metal detection. We're probably behind where a lot of organizations are on CWDs, but we've been doing actual metal detection at our main emergency room since 2007, and we screen approximately 400,000 people a year on average, and about 12,000 weapons are detected in doing so. Now, those are not always guns and knives. We're taking anything that's a stabbing type device off of people before they go in the emergency department. So we also do wand searches for all AMS patients on arrival. So I wanted to talk a little bit. We're proud of this program. We feel we're a little unique in it. That years ago we were having issues, and the issue was that our local integrators, and we have some great integrators, this is not putting them down at all, but they usually have a tech on call. He or she is not always knowledgeable of our facility, and so if you have a power supply fail and that door strikes on fail secure, and a nurse can't get into a med room, it becomes an issue. And then so you call the integrator, they send a tech, the tech's never been to your hospital, so you're still having to drive in and open the doors for them and what have you. So we started our own apprentice program, and it's been about 24 years now, and we currently have 6 in-house certified technicians. That's our team at the bottom. There's a machinist in that group. There's a guy that owned his own sprinkler installation company in New York, and then there's one of the gentlemen there. He does a lot of our program, and he has a 4-year IT degree. But they also get bumps in pay as they are certified on the different things that we use, like magnetic barriers, and we use Secure for our access control system, Medico locksmithing. When you look at labor rates on what integrators are charging and what our expenses are, and we look at our PMs and our repairs, we save about $450,000 each year just in labor. And we're able to turn around and use that money that we normally be spending, and that's how we've been able to purchase additional equipment. So our system training, years ago, we started another acronym. It's the WARE program. You can see the acronym there on the right. It basically consists of 2 computer-based programs. One is the Intro to Aware, just talks about being aware of your surroundings, and it includes the shots fired in healthcare video. And as an organization, we use Simpler as our web-based CBL learning. So that gets pushed to different departments. And then the Stay Aware is an annual video CBL that we put together that includes updated information about workplace violence and what have you. And in the time frame, the 3 years leading up to us submitting our packet, we had over 52,000 students, contractors, and physicians and employees that completed one of the AWARE training programs. As mentioned earlier, we use MOAB. We approached MOAB a few years ago. A couple of our trainers had been certified in MOAB since 2007. We're fortunate enough, MOAB signed off on so 3 of our folks being instructor trainers. So we're able to host our own courses. And by doing so, we now have 83 MOAB instructors across our system. A lot of those are clinicians. Some of them are plant operations and maintenance folks. And so we currently, it's almost 12,000 employees trained in de-escalation techniques now, and that being MOAB. We use AVERT, which is now AVERT. They changed the E to I. I think that's emergency to incident, but we have 29 certified AVERT instructors, and we trained over 1,000 employees on hands-on training, and pretty neat course. I tell people all the time, if you can come in as a department and go through it, and we'll let your boss be the active shooter, and it's one of the only trainings that you can go through that you actually get to throw stuff at your boss with the Nerf balls and what have you. So giving credit where credit's due, I spoke about best practices. In 2023, for those of you that were in Nashville at the ACNE, Robin Rice from Florida gave a presentation on using an unoccupied nursing unit and setting it up to do active shooter training. And we did that. We were fortunate enough to have a unit to do that. And we did it multiple days. We'd have a class starting every 30 minutes. It was basically a 10-minute briefing and then 10 minutes of drill and 10-minute debrief. Law enforcement participated. They shot actual blanks, which was something new, for a lot of the clinicians that came. They'd never heard a gun go off inside a building, and the smell of gunpowder and what have you. We had over 700 participants, and one of the results that came from that is we had a emergency number for about 20 years, and when it was originally developed, we did not, as an organization, want people from the outside to be able to call the internal emergency number. But what a lot of the comments we got out of the drill is as people sheltered and they got on their cell phone, they didn't know other than 911 who to call. And so we now have a new emergency phone number throughout our system. And at orientation, hospital orientation, employees are encouraged to program that number into their phone day one. We do a workplace violence survey. Proud of this. We're involved right now. We're in our last week of the survey. We've been doing it. This will be our 3rd year of doing it across the board throughout the system. We have about 5,200. I wish the participation was better. That's about 25% of the employees that actually take it. But we use that survey and present to administration and the hospital board, and we've been able to add card access, improve exterior lighting, increase cameras, and then this is one of those things that we actually use to show are all the additions that we're making a difference in the perception of safety. We may not have any incidences in a garage, but employees may still not feel safe. So we listen to what they say. We've improved lighting. We've added cameras. And then from one year to the next, being able to see whether those efforts have made a difference. So we had each facility was doing their own thing with signage. Some people were going to Amazon and just ordering no weapon signs and posting them at their entrances. So we worked with marketing and admin and came up with a signage portfolio. You can see that's our aggressive behavior won't be tolerated. That same sign on the second one there, that's our admissions packet. and that's our president there. You see his picture. And so we were able to get that sign put on the second page of every admission packet. So every patient sees that, and we know patient to employee violence is about 90%, across the board here and nationally from everything I've read. We improved our equipment and use sign and added our security number to it, and then our no weapons or weapons prohibited sign. That's the one marketing came up with, and that's the one that we're using system-wide now. Visitor management. We've been doing visitor management for about 5 years now, thanks to COVID. It's one good thing that came out of COVID. We register about 500,000, about 500,000 documented visitors each year. That process has allowed us to actually stop multiple, and so this past January was 5 different ones of illegal narcotics making it to patient rooms who were self-medicating. It also is tied in sex offender database, and we loaded all of our active trespass warnings. If you can imagine, there being over 300 folks that's been trespassed that have active trespass warnings, it's difficult working at entrance to remember 300 people's faces. So we entered them in, and we've had 6 hits so far, and so people that were previously trespassed trying to get in the building having to show their ID. So that's been a positive thing for us. K9 teams. So you see, I wrote Trailblazing, Don't Give Up. We first proposed our K9 team in 2012, and Molly and Calvin are our first K9 team, and they went on the floor in 2022. So it took us 10 years to get approval. That's not trailblazing for healthcare, because I know Banner Health's been doing it for 40 years, but it's trailblazing for us, and we were the first dedicated security team in the state of Alabama. Since that time, UAB and police department and their hospital have added a couple of teams, so we're not the only teams in Alabama, thank goodness. But she is trying to track, and she's trying to detect illegal drugs. We've done that many times. She also finished first place in the 2023 NNDDA, which is a Southeastern competition. She beat out 120 other law enforcement agencies. We were the only healthcare security team there, so we were proud of that and Molly's accomplishments. We added our second team this past spring, and that's Daisy. She's a Belgian Malinois that came from Holland. She's trained on firearms detection. And then you'll see there, they continue. They're our favorite employees in the department. They're great for morale, publicity, and deterrence. And Molly, this is her 3rd year this fall, so she'll be, we're promoting her to sergeant in the fall. Those K9 on duty are actually posters and signs that we've got put up, but we also do billboards inside the hospital. They're big TV screens. And so those signs rotate on those information pieces throughout the hospital also. A few miscellaneous things. We worked with admin and purchased and installed 21 additional AEDs in public areas across our campuses. Our officers, you'll see on that bottom left picture there, that's a NFC tag where it says security with a number on it. We scan 1.8 million checkpoints a year, and we added a mobile camera last year for construction and event security. We check over 2,900 fire extinguishers every month, and we perform just over 300 fire drills each year. That's done in our department. We are responsible for a 200 vehicle fleet. This is all the non-emergency, non-ambulance vehicles we're responsible for. This includes, I showed a picture of the 2011 tornado. And just to say that, in the state of Alabama in April of 2011, we had 249 deaths, and then we had 650,000 people that were out power for almost 2 weeks. The night of the tornadoes, I was on top of our building and you looked out across the city and it was solid black except for the city's jail. You know, they were the only one that's on generator power. And as a hospital, we didn't have power for 5 days. And when you're running a courier service, when the city doesn't have power, the gas stations can't get gas out of the ground. So it can shut your fleet down. So we now have EVs and our chargers are on generator power. So as long as we can get fuel to our generators, we can keep vehicles on the road. And then we have 4 compressed natural gas vehicles. So barring an earthquake, severing a natural gas line, the generators are the compressors are on generator power, so we can keep those vehicles on the road if that event ever happened again. Our department participates in Toys for Tots. We've been doing that for 20 plus years. We do No Shave November for our officers, and we've raised over $1,000 for cancer. We also, anytime an employee in our department has an immediate family member pass away, we have some healing gardens around the hospital, and we purchase a brick in their memory, which has been, you know, it's been a good thing to do. People can go on break and go to the healing gardens and at least see that, you know, versus buying flowers. We did a cyber drill. This was prompted by the CrowdStrike. You know, we always say never let a crisis, even if it's someone else going through it, go to waste in healthcare. You know, we tend to get money in healthcare security after an incident. So we used that, and we did an internal security cyber drill. And the result of that is we were able to add 23 additional emergency downtime cellular desktop devices so that we could remain in communications if that were to ever happen and the network was shut down. We also do a shift change meeting. All of our officers are on a call at the beginning of each shift. They all report and state if they need equipment or what's going on. And so you can see that's 800 plus meetings we do a year with our staff. And the bottom grid there just shows our dispatches and incidents from our command center calls and what we've done. Pretty proud of this. We are, state of Alabama does not allow hospitals to form their own police departments. We're some of the hospitals that are university based, like UAB and University of South Alabama, they have police departments because colleges are allowed to have police departments. We have not been able to, that's a box we're wanting to check one day, and we've talked to Tony Pope, and we've got a game plan that we're working on. But in lieu of that, we worked with our local police department. We brought them in. We took a building, we renovated it. The hospital spent over $400,000 to renovate to give the police exactly what they need. Those officers have a badge. One of our badges that accesses general area. They're familiar with our buildings. They can go to the wellness center and work out for free, and they get the same discount as our hospital employees. And the end result is we've added a police presence without having to. I know we spent $400,000 on the building, but without having to pay someone to be here. We've got multiple officers on campus every day, and they're familiar with our property. So IAHSS Week, that's our flyer for this year, if you guys have not seen that. So we do our skills fair. Naturally, the officers have to be recertified in TASER, Moab, and what have you. And we do our annual skills fair during that week. What we're doing is we do a tailgate party. And so we cater breakfast, we cater lunch. It's a tailgate theme because we're from the South, so it's usually football themed. And so we have cornhole tournament. And then we retire anyone that's worked 10 years. We retire their jersey, and as you guys can see, that's a hockey jersey and not a football jersey. But I'll share with you a little trivia. In the 1980s, Huntsville, Alabama was named as the hockey capital of the South. because we were the only UAH here in Huntsville, won the national championship, and we were the only Division I school south of the Mason-Dixon line that had a hockey team at the time. So we do a hockey jersey to retire. We also we rent out a place, and we do awards on Thursday night during that week. We do our Pride Awards, TNT, Courier, VCO of the Year, Dispatcher Officer, Team Lead Technician, and Department Employee of the Year during that week. That's just part of the recognition program packet that we do. Going through real quick, a couple of scenarios. I just wanted to kind of show the group what we did and how we kind of put it together to show improvement. We were spending about $800,000 a year leasing a parking lot and running shuttle service, providing security to that offsite lot. When an employee would leave the hospital, let's say they've been here 10 years and they resign or they retire, we didn't have a good way of tracking replacing that employee in a space or their parking lot. And so it was impacting the hospital's recruitment, engagement, and morale. And, you know, by the time you assessed the parking, what was available and what have you, it would take 3 to 4 weeks to make changes. And in doing that, you know, you had spaces that were not being utilized during those weeks. We worked with our IT team and built an HH preferred parking program. So employees get hired day one. They're assigned a lot that's not the most favorable lot, but it's within walking distance of the hospital. They're allowed to select their preferred location. And then when that same employee that's been here 10 years leaves and their parking opens, we're able to see a list of who's the most senior person that wants to park in that lot, and we can move them the next day. By doing that, we capitalize on every space, and we were able to stop shuttling. So that program saves the hospital $800,000 a year, and all of our employees are now parking on campus again, which has been really good for morale. Another case scenario is with workplace violence. We worked with the Madison County Commission and got a $50,000 grant to use at our facilities, keep them safer. We chose to purchase Omnigo with that. That picture is our county commissioner with our administrative team. And then we also worked with our foundation to obtain a $55,000 grant to go towards our K9 team. And then because we have such a great relationship with different dealerships because of our fleet, we were able to get a police interceptor at a discounted rate. So it's about a $52,000 vehicle we were able to buy for $30,000. And the result is that by using the Omnigo software, we were able to identify our high-risk areas, not only the area, but times of days that there were more risk. And then we were able to assign our K9 teams to those to do patrols of those units and be present during those times. And so far, we've seen double-digit reduction in workplace violence incidents by doing that. And so we're using this data to propose a third K9 team. This is an example of how we use our risk assessments. We do about 90 risk assessments each year. Again, you all know about the incident in Texas with the lady that ran into the ED. So we were able to use that incident to bring in FBI, Homeland bomb expert, structural engineers, the architects, and so long story short, we were able to get bollards, something that had been on our list to do that we couldn't get traction, but we were able to add those. As you can see, without those bollards, someone could drive straight into our emergency department. We are a not-for-profit hospital, so we don't typically qualify for FEMA and Homeland Security grants. And so we have to kind of try to go get money a different way. And so these are just a few of the awards. We were awarded a $20,000 grant for the AVERT instructors certifications, $50,000 grant for Omnigo, as you saw, $55,000 as you saw for K9. The police interceptor And then this year, since that time, we've obtained two different $20,000 grants. One to upgrade cameras at one of our smaller facilities, and one to install our wearable duress system at one of our behavioral health facilities in a different county. So going through, putting all of that together with the training and what have you, the results that we were able to show was that workers' compensation injuries from 22 to 24 went down by 79%. We were able to, we promoted, as you guys know, with the Joint Commission standards of people didn't typically call you when they were being verbally abused. So we really had a push for, call us for those type incidences. So our reporting did go up. And then thefts have decreased by almost 18%. Our Press Ganey scores went up by 4.34. That was January numbers. We've actually increased that by almost 2 more points since January. The next came from our employee survey, almost a 6% increase in perception of safety outside the hospital. That was done with officer presence, signs, and better lighting. We've decreased the number of workplace incidents system-wide by 8%. Decreased workplace violence incidents on our behavioral health unit here at our main facility by 9%. Assaults by 11%, the same area. We've increased the number of EMR flagged patients by 350% over 3 years. So anytime someone acts out, we flag them in our EMR. So if they're at one facility today and they act out and they show up at another facility tomorrow, we all get messages and we send the officer down. They let the person know that we know they're there. They just basically say hello, and then we implement the magnet program with them. We're proud of this fact that there's been 0 injuries from repeat offenders on the magnets. We had 700 plus employees do the active shooter drills. We've already talked about the money. And then really proud of this. We were able to go to admin, and one of our incentive goals as a system was for employees, employee training with de-escalation training. So there was a goal set, and we achieved that goal earlier this year. So the potential almost $2 million has been paid out, and so we're proud of that. We talked about the Moab instructors and the officers, and that we've been a program of distinction for 9+ years now. We've got over 750 years of safety and security, healthcare safety and security experience in our department. And that's just a compliment to our team and our retention efforts. And all of that we've done, the increased communication and all the retention efforts, our employee turnover has decreased by 33% since 2022. We do save $800,000. That's the parking that we talked about. We also, if you guys see how many miles driven, our fleet team worked really hard on getting rebates for some gas and vehicles, electric vehicles, and what have you. And so we've decreased our cost per mile driven by 2 cents, which doesn't sound a lot, but when you drive that many miles, that's like $30,000 a year savings just from being able to do that. Our courier services, that's a real number. We had 2 different companies that came in and put bids in, and us operating the courier service ourselves versus paying an outside agency to do it. We saved $1.3 million a year, and you can see the different pickups that our couriers do each year. We maintain confidential documents. We've got over 5,000 boxes. Naturally, there's different things in the boxes, so they all expire at different times. We did at one point have an outside company doing that, and so we now have that in our warehouse, and we purge those documents and destroy them each month as they come due, and we save the hospital over $200,000 by doing that. Train over 3,000 employees on fire training each year. And then real quick, what we're working on today, this year, our third K-9 team, we're trying to get funding and approval for it. Assessing our VMS, you know, does having all visitors have to scan their ID decrease crime in the hospital? And so we're putting those numbers together and hoping to show that because we're not doing VMS at some of our newer partner hospitals. And so we're hoping to propose that and show that it does decrease incidences. We've got a new administrative suite being built, and so we're working on the design with industry guidelines and executive protection models being used there. We're expanding our wireless duress to parking lots, body-worn cameras. We're not there yet. Our legal team won't sign off on it, but we're still working on it. We've got our second Alabama Healthcare Security Summit coming up in December. We've got the president of ASIS coming to speak. We've got a U.S. congressman coming to speak. So if you want to come to Huntsville the first Friday in December, come join us. Also developing a Left to Bang training program for our officers, thanks to Lisa Terry, sat through her presentation this past June in Phoenix. And so real quick, I'll just say, if you're thinking about submitting recommendations, is start early. It's a lot to put together. Don't give up. You know, we did not win our first year, and think about presentation. And I'll show the picture there to the right. It's the same person. So sometimes getting a second set of eyes and how you put it together and making it more presentable is pretty important. That is my contact information for anyone that might want it.
Thank you, Brett. That was really informative. And as you can see, he's displaying the call for submissions for the Foundation Recognitions Award. The deadline to submit is January 30th. And there's the website. If anyone has any questions, now would be the time to enter them in the Q&A option in the bottom of the screen, because we have a few minutes left. Let's just give it another moment or two and see if anyone has anything. And a lot of nice comments coming in the chat.
Brett, that was an outstanding presentation. Thank you very much. I would hope somebody would have some kind of questions. You've got the Lindbergh Bell Award winner there in front of you. So don't be shy. If you've got a question, please ask it now.
Okay, jumping in here, we've got a question. What company do we use for visitor access? We're using Passage Point by Stopware. Our EMR is Cerner, and because of their HL7 sniffer and because Cerner integrates with our access control system so that we can control elevators, that's why we selected them. There's a lot of other companies that have really good products, just depends on what you're looking for. And then what were the email addresses? I will scroll back up.
Okay, if anyone has any other questions, please type them in now. Otherwise, we will conclude our webinar. Brett, that was a fantastic presentation. Thank you. And as a reminder, this was recorded, so it will be available shortly in the IAHSS store, free to members. Let's see. I don't see any other questions coming in, so I think we'll wrap it up. Thank you, Brett. Thank you, Bill. Always a pleasure. All right, everyone, have a great rest of the day. And thank you for joining us. Bye-bye.
Thank you, Heather.